Well, we don't talk about it so much anymore, but over the last week, more than 25,000 cases of COVID-19 were reported across Australia. The number of hospitalisations increased by an average of 13% compared to the previous week. But new research from the Murdoch Children's Research Institute suggests young patients with COVID-19 can be treated safely at home, which can help take the burden off the hospital system. Associate Professor Penelope Bryant is a paediatrician who works with the Murdoch Children's Research Institute and joins us now. Thanks for doing so. First, could you tell us more about this study? How many children were involved and when?
Good morning. Thank you very much. It's very nice to talk to you this morning. So this was a study that happened over the first 2 years of the pandemic, and it was really looking at how many children we could look after under hospital in the home. And we looked after 421 kids with COVID and another nearly 7,000 kids in hospital in the home without COVID. But the study was really focused on the patients that we treated with COVID.
All right, so how did the study work? Can you tell us more about this hospital in the home program?
Yeah. So Hospital in the Home is a program where your child can be looked after at home when they're acutely unwell, with a paediatric nurse or doctor visiting them in the home. For example, we can give IV antibiotics for serious infections, we can give oxygen for respiratory conditions, and even chemotherapy to kids with cancer. But for a child with COVID, you really want them to be treated in the right place at the right time. And a small minority of children will have symptoms severe enough to need hospital. And the vast majority will have a mild illness that can be looked after by their parents with community support where necessary. But then right in the middle is hospital in the home care for children who are moderately unwell. For example, having some difficulty catching their breath or not drinking enough and becoming dry, or kids with really high-risk conditions at risk of becoming more severely unwell and who need a paediatric nurse or doctor reviewing them daily. And what the study showed is that this group of moderately unwell children and with high-risk underlying conditions can really be safely managed in their own home. And by using hospital in the home resources, we can take the burden off hospitals and then preserve hospital care for those few who need it most.
And what sort of resources are required?
So from the point of view of a hospital in the home, that really involves having a nurse or a doctor being able to review the patient. We also have a whole allied health team, including physiotherapy and dietitians and speech pathologists for patients who need it. And what it means for parents is that they have the security of knowing that there are people who know how to look after COVID, being able to review their patient and have 24-hour monitoring of their child. We know that home is the best place for children because they have a much better quality of life. But during COVID, it's even more true since in hospital there are necessary restrictions for movement and visitors.
And so to be clear, what do you recommend for patients who are considered high risk?
So for patients who are considered high risk but really have relatively mild symptoms, they can safely be looked after by hospital in the home by having somebody reviewing them, doing in-person visits or telehealth every day. And for patients who have more severe symptoms, they should always be at least reviewed and considered for being whether they need to be in hospital or not. But for the vast majority of children, they don't need to be in hospital.
And are such things as those telehealth consultations as readily available these days as they were back at the height of the pandemic, Penelope?
Yeah, they actually are. And I think you're absolutely right when you said at the top of this that we don't talk about this anymore. But the people who are looking after children with COVID are still doing exactly as much as they were during the height of the pandemic. And telehealth has been a really useful adjunct to our care to be able to make sure that families can feel that people have eyes on their children at home.
Still pretty busy in the hospitals. The number of hospitalisations up by about 13% in 1 week alone. How are they coping?
Yeah, so I think the coping is related to everyone trying to use their resources smartly, and that's partly about trying to make sure that we are seeing the patients in hospital who really need to be seen, and then getting the patients out of hospital and being looked after at home where they can be. But it's a matter of really just trying to make sure that everybody is treating the right patients in the right place.
And as far as parents or caregivers trying to decide if they should be treating their children at home, who makes that decision? Do you think that relies on that formal opinion of someone they consult?
Yeah, I think that, the public health teams have been absolutely critical in determining who should be looked after at home and in hospital, and parents certainly shouldn't be expected to make that decision themselves. The most important thing is that people feel that they've got the support that they need and can always contact somebody for a definite decision. But parents are always given the option of whether they're in hospital or in hospital in the home. So it's not a thing that anyone's told they have to do, but it just gives them the knowledge and support that they can be looked after in the home safely and have that reassurance.
And are most children still proving as resilient as we first thought to this virus, Penelope Bryant?
Children are remarkably resilient, and that remains true. And I think, particularly with the Omicron variant, it has proved to be a mild illness in children, for the vast majority of children. But yeah, children are resilient and they bounce back quickly. So even very young children who were treated under hospital in the home, so we treated children as young as 2 weeks old, have been remarkably resilient and bounced back. But I think that's been a very reassuring thing for parents, because it can be scary when your child has an infection when they're that young.
No doubt, but keep them out of hospital if you can, and take the advice as required. Interesting indeed. Penelope, thanks for joining us this morning.
Thanks so much.
Associate Professor Penelope Bryant, paediatrician with the Murdoch Children's Research Institute, about how we can best treat children with COVID, and there's no shortage of them, it seems.